Good morning, everybody. Welcome to Untangling Amyloidosis 2023. I'm Jeffery Zonder. Don't seem to be able to, there we go. I'm Jeffrey Zonder from the Cancer Institute, and I'll be moderating today's session. This is our fifth Untangling Amyloidosis Symposium, and I want to thank our planning committee for their incredible assistance in putting this together. These meetings are an incredible amount of work. Thank you to Andrew Kinn, our program co-chair, and especially to Christy Hood, who was heroic during the planning of this symposium, and without you, this could absolutely not be taking place this year. So thank you so much, Christy. These are the planning committee disclosures. And here are the objectives for today's session. Today we want to help the audience to understand how to accurately diagnose and assess prognosis of AL amyloidosis. We're going to discuss the criteria for autologous stem cell transplant as therapy for AL as part of one of the lectures, and then in discussion afterwards. And we're going to provide data to help formulate evidence-based therapy. We're going to talk about best practices regarding cardiac imaging of amyloidosis, and in order to do that, we're going to be talking about both AL and ATTR amyloidosis, and we're going to talk about the therapy of ATTR amyloidosis. As hematologists, we don't always manage that. In fact, we often don't manage it. However, the therapeutic successes in that clinical area have relevance for future potential therapies in AL amyloidosis, and so we want to talk about that. And then finally, we want to talk about one of the complicated issues that we face in patients with AL amyloidosis, which is abnormal bleeding or clotting complications. And we have a great talk planned for that. This is the agenda for today, and the speakers who will be covering all of these topics. Very excited about our panel today. Eli Mukhtar from Mayo Clinic, Dr. Giada Bianchi from Harvard, Laura Opici from Pavia, and then we'll be rounding it out with a talk from Dr. Rafat Abenauer from Indiana. There will be a question and answer session, a panel discussion that'll be about a half hour at the end of all the talks. People will have the opportunity to step up to microphones and ask live questions, but there is also an online, an audience response system that you can access with your devices. I'll tell you a little bit how to do that, but you can also directly text us questions that we will see up here and that we can address during that panel discussion. I want to thank the sponsors of the symposium. The CME is provided by Wayne State University and the Cancer Institute. I want to, in a heartfelt fashion, thanks the nonprofits who've supported this, the Amyloidosis Foundation, Amyloidosis Support Groups, Amyloidosis Speakers Bureau of Mackenzie's Mission, and also I want to thank the Amyloidosis Research Consortium for their promotion of the event through social media. This event was supported by generous educational grants from Janssen Biotech, by Prothena, and by Alnylam Pharmaceuticals, and without all of you, also, this could not be taking place, so thank you all very much for your support of this. This is a CME event that is designated for a maximum of 2.25 AMA PRA Category 1 credits, and people who are, I thought we removed the the animation. People who are present, attending today, we would like you to claim your CME within 7 days of the event, and that can be claimed online. And if you have any questions regarding claiming CME credit, Christy Hood, email shown here, can answer any questions that you might have to help you with that. As I mentioned, we do have questions and comments that can be submitted directly via the online link. On your table, there are QR codes, and one side is the QR code for the post-symposium evaluation, but the other QR code is for the audience response questions and for asking your questions. So you are using your own device, so please use the camera on your phone to scan the QR code so that you can be prepared to participate in the questions during the symposium. This is also the QR code, but it might be easier to use the one on your table. I'll keep it up for just a few seconds here. And we are going to go through a few audience response questions now to help us understand who's in attendance today, but also to help you understand how to use the ARS system so that you're ready during the presentations to answer the questions. So let's start with question number 1. Which of the following best describes your title or employment? A, hematologist-oncologist, and this includes trainees, fellows in that area, physicians in other specialties, including residents or fellows, mid-level provider, such as a nurse practitioner or physician's assistant, a nurse, or a pharmaceutical company employee. So we'll give you 15 seconds to answer this first question. Okay, so here are the answers, and we can see that most of the attendees in the room are physicians, about 3/4, and also representatives from, my audio definitely sounds a little different now. I'm not, does it? Okay, all right. We'll go on to the next question, please. Which of the following best describes your practice type? And this is going to be relevant to the physicians and nurses and nurse practitioners. A, comprehensive cancer center or university hospital. B, community hospital with an academic role. C, a community hospital without an academic role. D, bench or translational research. E, other. And I think not surprisingly at the ASH meeting, most of the attendees at this session are academically inclined clinicians, including about half of people at universities or comprehensive cancer centers. We'll go to the next question, please. How many AL amyloidosis patients have I personally treated in the last year? I don't think that necessarily means new patients. I mean, how many patients' care have you been involved in the last year? A, 0, B, 1 to 3, C, 4 to 6, D, 7 to 10, E, more than 10. All right, so a mixed level of experience, some quite experienced, and some who only occasionally see a patient. And one of the goals of this session is going to be to help, all learners in this audience with management questions. So I think the format of today's talk is going to be suited for the sort of the diverse experience that people in the audience have. And then I have one last question. How many ATTR amyloidosis patients have I personally treated in the last year? A, 0, B, 1 to 3, C, 4 to 6, D, 7 to 10, and E, more than 10. And this is my last question, and I think this answer isn't particularly surprising. I think that most hematologists don't treat ATTR amyloidosis, but there are probably center-specific reasons why people do, and so we do have some who treat a few ATTR patients, and a couple of people, and I know who you are. I'm looking right at one of them. I know who you are, who treat quite a number of ATTR patients. So with that, our practice questions are done, and I'm going to now introduce, if I can